In recent years, the global number of people living with myocardial infarction has reached 254 million, an increase of nearly 40% since 2010. But when we talk about a heart attack, what exactly is getting blocked? In today's video, we're going to take a close look at the 3 life-giving pathways that supply blood to your heart. You see, these 3 blood vessels cling tightly to the surface of the heart, originating from the root of the aorta and wrapping around the entire heart like an exquisite crown. That's how they got their name, the coronary arteries. All diseases related to these 3 vessels are collectively known as coronary artery disease, CAD. And the most dangerous, life-threatening manifestation of CAD is myocardial infarction. The coronary arteries are mainly composed of the left anterior descending artery, LAD, the left circumflex artery, LCX, and the right coronary artery, RCA. Each supplies blood to different regions of the heart muscle, and every single one is absolutely vital. But their personalities and levels of danger vary significantly. The left anterior descending artery is the most problematic and deadliest of the 3. Branching off from the left main coronary artery, the LAD runs down the shallow groove on the front of the heart, extending all the way to the very tip of the heart. It supplies blood to the anterior wall of the left ventricle, the apex, and the anterior 2/3 of the interventricular septum, and the left ventricle is the absolute workhorse of the heart's pumping system. If the proximal segment of the LAD becomes acutely blocked, most of the left ventricular muscle will die instantly, and the heart's pumping function will completely shut down. The left circumflex artery also branches off from the left main coronary artery, separating at almost a right angle from the LAD. It then travels to the left and back, wrapping around the left edge of the heart all the way to the back surface. It primarily supplies blood to the left atrium, as well as the lateral and posterior walls of the left ventricle. The right coronary artery originates separately from the right coronary sinus at the root of the aorta. It runs down the groove on the right side of the heart, wraps around the lower edge, and finally turns to the back surface, where it continues as the posterior descending artery, PDA, near the posterior interventricular groove. It mainly supplies blood to the right atrium, the right ventricle, and the inferior and posterior walls of the left ventricle. A blockage in any of these 3 coronary arteries can trigger coronary artery disease, and in severe cases, a heart attack. In daily life, if you experience unexplained chest pain or tightness, or pain that radiates to your left shoulder, back, or other areas, and it improves with rest, this could be a warning sign of angina. If the pain lasts more than 15 minutes, doesn't go away with rest, and is accompanied by heavy sweating or shortness of breath, call 911 immediately. Never drive yourself to the hospital. Caring for your heart starts with protecting your coronary arteries.